In this video, we will discuss about neural tube defects. We will also discuss their two types, anencephaly, spina bifida. What are neural tube defects? Neural tube defects are congenital malformations, resulting from improper closure of the neural tube during embryonic development. How are neural tube defects formed? In the developing embryo, the neural tube forms and closes by the 4th week of gestation. Between days 21 to 28, failure of neural tube's pores to close properly leads to neural tube defects. What is epidemiology of neural tube defects? Neural tube defects are among the most common congenital anomalies, affecting approximately 1 in 1,000 live births worldwide. Causes and risk factors of neural tube defects. These are most common causes of neural tube defects: folate deficiency during pregnancy, maternal conditions, for example, diabetes, obesity, exposure to teratogens, for example, valproic acid, alcohol. How prenatal screening of neural tube defects is done. Prenatal screening is done by maternal serum alpha-fetoprotein levels. Elevated levels suggest an open neural tube defects. In case of positive screening, the next step is prenatal confirmatory test for neural tube defects. Confirmatory test is done by amniocentesis. It detects elevated acetylcholinesterase levels in amniotic fluid. For confirmation, types of neural tube defects. There are two types of neural tube defects. Anencephaly, it occurs due to failure of the cranial neuropore to close. Spina bifida, it occurs due to failure of the caudal neuropore to close. We will discuss both of them in detail. Number 1, anencephaly, it occurs due to failure of the cranial neuropore to close. Baby shows absence of a major portion of the brain, skull, and scalp. It is typically fatal. Number 2, spina bifida, it occurs due to failure of the caudal neuropore to close. Since the spinal column fails to close completely during fetal development, it leaves the spinal cord and meninges exposed, or improperly protected. It can range in severity, and affects the nervous system and musculoskeletal structure.